you're watching this video, you've successfully navigated one of the first challenges of getting into medical school here at Stellenbosch University. My name is Dr. Derek van Vieren. I'm the MBChB Program Coordinator, and in this video I'll give you a quick overview of the MBChB curriculum at Stellenbosch University and also hopefully give you some food for thought. So one of the first things that a person has to ask yourself, that you have to ask yourself, is what does it mean to be a medical doctor? What is it to be a doctor? In my experience talking to students and public in general, it's clear that popular media and TV series have a big influence in how people view the profession. But I want to encourage you and challenge you as you're deciding and as you've applied for medical school to do the research, talk to people, go and see if you can job shadow and get an idea of what it really means to be a healthcare practitioner. Yes, there is the whole intellectual component, knowing about the human body and helping people, but there are many other components to it as well. You have to be able to communicate with people, you have to understand people, you have to be able to work with your hands and do physical things like measure blood pressure or take bloods. And so there's many different components to being a medical doctor. And so it's no surprise that a few years ago, globally, people started wondering and defining what does it mean, what are the different aspects of being a doctor. And closer to home, here in South Africa, the Health Professions Council of South Africa adopted some of these ideas. We've adopted it within the Faculty of Medicine and Health Sciences as our graduate attributes. These different facets are critical for a medical practitioner for becoming a doctor. Yes, you have to be a healthcare practitioner, but you've also got to be comfortable with research. You've got to advocate for the health of your patients and the community. You've got to be a leader, a manager, be able to collaborate and realize you're part of a team, communicate effectively, and of course be a professional. And what does that mean? I mean, that refers to how you view yourself and your identity and ethics and aspects like that. And so in our MBChB curriculum here at Stellenbosch, we've designed the curriculum to explicitly include these different aspects in the curriculum. So let me give you a quick overview of the curriculum. The first 3 years starts off with 6 modules. This is an interesting structure. Each of these modules is highly integrated and quite frankly huge. Each semester is taken up by a module, and so the first 3 years or 6 semesters each has a module per semester. And as I mentioned, these modules are highly integrated with different disciplines all contributing. There is a flow to it. It makes sense, and let me quickly show you how that works. So you start off with some of the basic sciences. The focus is on what is normal, what is it to be happy and healthy. That's basically the first 18 months of the program. How do you prevent disease? How do you promote wellness and health? After that, the focus starts shifting to how things go wrong, and how does that look like? Why do things go wrong? That's the pathology behind it. At the start of 3rd year, now that you know more about disease and where it comes from, the focus shifts to how to diagnose it, how to think like a clinician. And then in the last semester of the 3rd year, how do you now manage this? How do you treat your patients and intervene in the situation? So there is this conceptual flow of the curriculum in the first 3 years. After that, years 4, 5, and 6 are almost explicitly dedicated to clinical training. Yes, there's one module kind of focusing on aspects around the professional role and how you think about yourself, and there's also a module about research, but both those themes are present throughout the curriculum. Now, year 4 and 5 is mostly taken up by clinical training in Tygerberg Hospital, which is the tertiary training hospital right next door to campus, and I'll show a picture of that just now. And in the final year, the distributed clinical apprenticeship is exactly what the name says. You'll have the opportunity to be an apprentice, to join the healthcare team in a hospital setting and learn and train by being part of the team. This happens on our distributed training platform outside of Tygerberg Hospital. A few other things about the curriculum. I've already talked about the graduate attributes. These are weaved within the curriculum throughout each of the modules and the clinical training from year 1 to year 6. Alongside these graduate attributes is the focus on the core clinical curriculum. Not much to say there, but just to emphasize that at the end of this degree, you'll be able to go into internship. So sometimes students think they'll be a doctor when they're finished, but no. In these 6 years, we will only focus on the core clinical curriculum, the basics, so that you are able to navigate internship. There are also what we call the 4 pillars, 4 themes that stretch throughout the 6 years. The first is the self, a focus on your identity and your identity development, professionalism. Then there's a focus on the patient. I suppose this is obvious and to be expected. But then there's also the realization that your patients come from somewhere. They come from a community, and so you have to understand that community as well. And you have to be able to navigate in the healthcare system. That's where you will be trained, and that's where you will practice as well. Now, one of the, I think, our biggest strengths in our curriculum is our clinical training and the exposure to the clinical platform. It starts early, it's longitudinal and stretched throughout the curriculum, and it is sustained. So here at Tygerberg campus, from semester 1, year 1, you'll receive training in the simulation and clinical skills unit, where you will have the opportunity to practice your skills without getting close to any actual patients. And as I mentioned just now, in year 4 and 5, most of our clinical training happens in Tygerberg Hospital, which is right next door to campus. In years 1, 2 and 3, we also have the longitudinal primary healthcare experience. Starting from the first semester in the first year, you will have the opportunity to go to a primary healthcare facility within around about a 15-kilometer radius of Tygerberg Hospital. We are really proud of our clinical platform. We think it's a massive benefit to our students. But it is important to note that we have to go where the patients are. Part of our philosophy is to be relevant to our local environment. And so many of these clinics are in places where you would maybe not usually go or would want to go. But it is important to realize as you step into this that that is part of the expectation. That is where we serve our patients. I've already referred to the distributed clinical apprenticeship. This is housed on what we call the distributed clinical training platform, one of the big strengths of Stellenbosch University. We utilize healthcare facilities across the Western Cape in training of our students, and so especially in year 6, you'll have the opportunity to step outside of Tygerberg Hospital and spend basically the whole year at a site somewhere else. We've got a satellite campus at Worcester, but we've got sites all over the Western Cape. And so it's important to note that if you decide to study with us, you will have to be willing for that opportunity. You've heard that MBChB is a lot of work, not to scare you, but also maybe good to mention at this stage that our timetable looks different in the timetable for the rest of Stellenbosch University. All the grey blocks that you see, that's the holidays. Everything else is when you're expected to be here. And so just a word of caution, if you're planning any holidays for next year, just check in with us before finalizing those dates. So at the end of it, where will you be after 6 years? Well, as I mentioned just now, our primary aim is to equip you with the knowledge, skills and attitudes, attributes, a way of thinking and approaching things so that you can function in your internship. And so maybe that leads us to the next question. What happens after graduation? Well, once you've graduated, you're not an independent clinical practitioner yet. You first have to complete 2 years of internship with the National Department of Health, and after that 1 year of community service. Only then can you register as an independent practitioner with the Health Professions Council of South Africa. I know that many of you already have in your minds where you want to be one day, and so many of you think of yourselves already as, I want to become a psychiatrist or a pediatrician or cardiologist. But also important to note, the journey to get there is a long one. You first have to complete MBChB, then do your internship, then do your community service, and then after that you have to participate in postgraduate studies. These postgraduate studies have to be affiliated with the university, and you have to have a position at a hospital affiliated with that university. It's a 4-year degree at a minimum, and only after you've completed that post graduate qualification will you be able to become a specialist. But I don't want to say much about this, but just to mention that there are also non-clinical options. If you decide that you want to pursue something else, a degree in medicine opens up many doors in many different fields, from education to economic, commerce, research, and so there are many other options outside of the clinical space. And so when you come to us, what can you expect? Yes, a steep learning curve. It's going to be challenging, but at the same time an opportunity to journey with like-minded people, your colleagues in the class with you, your lecturers and the clinical trainers who walk the journey with you, and also knowing that you're being trained by some of the best clinicians around in South Africa. Good luck with the rest of your school year, and all the best.